Hi, my name is Salazar. I go to talk about the education of clinical observation. The confrontation with diabetes this time. Okay, definition. The kidneys are part of the body and are responsible for cleaning the blood and to send the air hormone to the body. Diabetes is the leading cause of the kidney disease when the kidneys are damaged. The colorful your blood and the shoe became cause was the blood after report.
Diabetic kidney disease, or diabetic nephropathy, is kidney disease caused by diabetes. It's a very common diabetic complication affecting about one-third of people with diabetes type 1 and half of those with diabetes type 2. Diabetic kidney disease is responsible for most of the excess mortality associated with diabetes. Because the kidneys remove metabolic waste, control blood pH, regulate fluid and electrolyte balance, as well as produce several hormones, loss of kidney function results in accumulation of toxic wastes, electrolyte imbalances, and a number of other health problems. The disease develops slowly over time, progressing from renal insufficiency to end-stage renal failure. Often, initial loss of renal tissue does not produce any symptoms. Symptoms typically appear when a significant portion of kidney function is already lost. The ability to concentrate urine is usually the first to be impaired, resulting in frequent trips to the bathroom, especially at night. Other early signs include fatigue, loss of appetite, and decreased mental ability. Chronic high blood glucose levels, together with high blood pressure caused by diabetes, bring damage to tiny blood vessels in the kidneys, affecting their functions. Cellular degeneration in the functional units of the kidneys, the nephrons, in particular the podocytes of renal glomeruli, further contributes to the impairment of renal functions. Diabetes, especially when poorly managed, is the biggest risk factor for chronic kidney disease. Other risk factors are the same as those for high blood pressure and include smoking, having high cholesterol levels, and being overweight. Because initial loss of renal tissue does not produce any symptoms, it is important for diabetic patients to test annually for kidney functions. The tests typically include blood and urine analysis. Prevention and management strategies consist of controlling blood sugar levels, blood pressure, and cholesterol levels, all of which can be achieved with a combination of lifestyle changes and medications. Lifestyle measures typically include a healthy diet with low salt intake, increased physical activity, weight management, and smoking cessation. Among all blood pressure lowering medications, ACE inhibitors and angiotensin receptor blockers, which block the renin-angiotensin-aldosterone system, work best to protect kidney functions. End-stage kidney disease requires dialysis or kidney transplantation.
Okay, application application in medicine. As a medical application in the condition, the patient is diagnosed through blood tests, urinalysis, diagnostic imaging tests, and kidney function tests, and kidney biopsy, and according of that, the treatment is made with be applied. Studies have shown the drug that inhibit the renin-angiotensin system have the shown renal effects. And recent trials show where the real effects on empagliflozin, which the sodium glucose transported to HGLT2 inhibitor type 2 diabetes.
In 3 minutes. Let's begin. The SGLT2 inhibitors, or sodium glucose cotransport 2 inhibitors, are one of the newer medications used to lower blood sugar in patients with type 2 diabetes. These drugs can be identified by their suffix gliflozin. For instance, empagliflozin, or its brand name Jardiance, or dapagliflozin, or canagliflozin. So, how exactly do SGLT2 inhibitors reduce blood glucose levels? But firstly, what is SGLT2? Sodium glucose cotransporter 2 is a protein found in the nephrons of the kidney. Approximately 160 to 180 grams of glucose is filtered from the glomerulus into the Bowman's capsule in a day. SGLT2 is a protein in the proximal convoluted tubule that acts to reabsorb filtered glucose back into the blood. Approximately 97% of filtered glucose is reabsorbed into the body through SGLT2, and the remaining 3% is reabsorbed through another protein called SGLT1. As a result, very little glucose is excreted through the urine. As the name suggests, SGLT2 inhibitors, such as empagliflozin, bind to SGLT2 and prevent the reabsorption of glucose back into the body. As a result, more glucose is excreted through the urine, and this results in a reduction in blood glucose. So, to summarize, SGLT2 inhibitors act to decrease glucose reabsorption in the kidneys, resulting in increased excretion of glucose in the urine, and this ultimately leads to a reduction in blood glucose. Additionally, this medication may also help with weight loss, and it is worth noting that SGLT2 inhibitors do not cause hypoglycemia. Looking at the side effects of SGLT2 inhibitors, urinary tract infections and genital fungal infections, such as yeast infections, are more common in patients taking this medication. This is due to the increase in glucose in the urine, which promotes bacterial growth in the urinary tract. Some patients may also experience increased frequency of urination, and this may lead to lower blood pressure due to the loss of fluids. Some patients may also notice a slight increase in their cholesterol values, as well as some nausea.
Pro and cons. The use of empagliflozin in diabetes have the pros and cons. Pro. Have a lower risk the hypoglycemia and low body weight, a beneficial effect of the microvasculature, especially in the progression of the diabetic nephropathy. Con. Among the disadvantages of the empagliflozin, we have increased risk of urinary infection and risk of cetoacidosis. Is applicable in Ecuador. In Ecuador, the work is part of the Los Rios province of the condition, the social environment, in the biological determinant of diabetic nephropathy in the Ecuador are named at the Institute Rush project led by PhD Del Brown. Conclusion. After many years, either now over the SGLT2 inhibitor can correct the disactivation of the tubular glomerular back that occurs diabetes, which together with renin angiotensin system inhibitor of protect effectiveness. And